Good day, I am Jasmine Sadania from BSN 212G, and for today's video, I will be performing the Leopold maneuvers. So first thing to do is to perform hand washing to deter the spread of microorganisms. And then I have to explain the procedure to the patient to gain the patient's cooperation. Good day, ma'am. I am Jasmine Sadania, and I will be your student nurse for today. Can you state your name and birthday, please? Thank you. So, ma'am, I am here to perform the Leopold's maneuver, which means that I have to expose your belly and touch some parts of your abdomen. Will that be alright with you, ma'am? Okay. So, ma'am, this is done so that we can identify the presentation, position, and attitude of the fetus. And if ever you have questions or clarifications, please do not hesitate to inform me later during the procedure. Okay? So now I will close the curtains to protect the privacy of my patient. So now I have to ask the patient to empty her bladder before the procedure. So this is done because a distended bladder may slightly deviate the uterus. So ma'am, I encourage you to please void or empty your bladder so that you won't get uncomfortable during the procedure. So now I have to position the patient on supine with one pillow under her head and with knees slightly flexed. So these positions facilitate accurate assessment and provide comfort. Also, flex knees relieve tension of abdominal musculature. So then I have to place a rolled towel under the patient's right hip to shift the uterus away from large blood vessels and thus prevent supine hypotensive syndrome. So since I am right-handed, I am currently standing at my patient's right side to easily grasp the symphysis pubis to be done on the third maneuver. So let us now proceed to the first maneuver, also known as the fundal grip. So I have to face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. So the head feels hard and round, freely movable and ballotable, while the bridge feels softer and nodular. So ma'am, I will now expose your belly. Okay. Now for the second maneuver, also known as the umbilical grip, I have to palpate downward direction of the sides of the abdomen and applying gently but deep pressure to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. So we will know if it is fetal back if we feel a long continuous structure, and it is extremities if it feels nodular, reflecting the portion of the fetal extremities. So now for the third maneuver, or the pelvic grip, I have to face the patient. I have to place one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and fingers to feel the presenting part. Okay, so now for the last maneuver, also known as the pelvic grip, I have to face the patient's feet and move fingers of both hands gently down the sides of the abdomen towards the pubis. So this is to confirm the findings of the third maneuver and determine the flexion of the vertex. So now I have to locate again the back of the fetus and place a stethoscope over it and listen for the fetal heart tone for 1 full minute. So the normal fetal heart tone is 120 to 160 beats per minute. So after that, I have to note the location, weight, and character of the fetal heart tone. So in cephalic presentation, fetal heart tone can be heard in either left or right lower quadrant, and if it's breech, fetal heart tone can be heard above the level of the umbilicus, either left or right. So now that I am done with the procedure, I will now put the patient back to her comfortable position to ease and to promote relaxation. And lastly, I have to document the observation made, the fetal presentation, position, attitude, and whether engaged or floating. So this is done to promote database for future.